Occupational English Test, Listening Test. This test has two parts. Part A. In this part of the test, you will hear an optometrist talking to Claire, a woman who has not seen an optometrist for some time. You will hear the consultation once only in sections. As you listen, you must make notes about the consultation under the headings given on the answer paper. Turn over now and look quickly through Part A. You have 1 minute to do this. You must give as much relevant information as you can under each of the headings provided. You may write as you listen, and there will be pauses during the consultation for you to complete your notes under the relevant heading and to read the following heading. There will also be 2 minutes at the end of the test for you to check your answers. Give your answers in note form. Do not waste time writing full sentences. Remember, you will hear the consultation once only, and you should write as you listen. Now look at question 1. Question 1 has been done for you.
Well, hello. Look, my name's Joseph Crush and I'm your optometrist. So how are you today?
Hi, Joe. It's nice to meet you. I'm very well, thank you. How are you?
Oh, good, thank you.
Good.
And now, you've obviously come in for an eye examination. Is there something specific that you've brought you in today, or was it just for a general checkup?
Well, there is something specific, but we probably need to start in general terms. It's the first time I've been to an optometrist for some time.
Okay.
I've just moved back here from studying overseas for several years. So perhaps you'd like to hear a little bit about my general eye health history, but I have been having a little bit of trouble with my contact lenses as well.
Now look at question 2. Take notes on Claire's recent history.
Okay then, well look, fill me in on all of that, and you don't mind if I take some notes as you speak, do you?
No, please,
oh,
please
that's
go
good,
ahead.
Good. And where were you living before you came to Australia?
I was in England for 4 years, and I saw an optometrist there just once in that time.
Okay.
Yes.
And 4 years, so
yes.
one check-up in 4 years.
Only one, yes.
Okay. All right then, well, so it's more than 2 years since you've had your eyes checked?
Yes, or it's probably about 2 years.
Okay then.
Now look at question 3. Take notes on Claire's contact lenses and the details of the problem.
And you were going to tell me about your contact lenses. Now, are they rigid or are they soft contacts?
They're rigid. I've
Okay.
always worn rigid lenses, and I've been wearing them since I was about 13 years old. But I've found in the last year or so that I'm starting to have a bit of trouble. They're a bit uncomfortable. They've felt, especially towards the end of the day, a bit scratchy.
Right.
And my eyes get weepy.
Right.
And so I'm not sure if I'm perhaps doing something wrong with the care of them, or whether it might be worth pursuing other options.
Okay, well look, you've been wearing them since you were 13, you say, so that's 15 years now, so that's quite a long wearing time. Have you had, in terms of years, have you had any problems with the lenses over those years, or has it just been more recently?
It's really just been more recently. On the whole, I've found them good.
Now look at question 4. You will hear a further discussion about Claire's current contact lenses. First, take notes on Claire's cleansing routine.
And with the cleansing routine, what are you doing with your lenses? So what system are you using?
Well, I just use, I've used for many years the same cleaner nightly, and I store them in a storage solution. I understand that there are special cleansers that you can get to use occasionally to break down...
Protein removal?
Protein removal, that's
Good.
it. And I do occasionally remember to do that. But
So not that regularly?
no.
Now, take notes on the history of Claire's current lenses.
And these current lenses, just to refresh me, how old are they now? 2 years? Or you mentioned you might have replaced them in between?
No, they were probably be 5 years old as well, I would say. I had new glasses and contact lenses before I went to the UK, so 4 or 5.
Now, you mean the actual product that you're wearing today, or the prescription for them?
The actual product and the prescription.
Okay, so they're pretty old, really.
Yes, they are.
Now look at question 5. Take notes on Claire's eye health and family history.
Just a couple of other questions. You've never had any injury or disease in the eyes at all?
No.
There's no allergies or anything that could be affecting your eyes?
Not that I'm aware of.
Okay, so you've never been prone to any allergies, hay fever,
No,
nothing like
I've
that?
had a little bit of hay fever when I was living in the UK, but nothing serious.
Okay, and just a couple of other questions, because I'm going to do the normal eye examination as well, because it's been so long, Claire.
Please, yes.
Was there any history of glaucoma or any other eye disease in your family?
One uncle has suffered from glaucoma on my father's side.
Okay, but your father doesn't have glaucoma?
No, he in fact has perfect vision. He's very fortunate.
It is unfair, isn't it?
It
so
is.
you must take after your mum. But no glaucoma on your mother's side there.
No.
Well, that's good. And no other eye disease? No macular degeneration?
No other problems that I'm aware of.
Fine. And no diabetes in the family?
No diabetes.
Oh, good. That's good.
Now look at question 6. You will hear a discussion about other contact lens options. First, take notes on the optometrist's explanation of astigmatism.
You mentioned that you wondered about some other options.
Well, I wondered whether, I wonder whether there are some other options with contact lenses. I don't know very much about soft lenses and whether there are, in fact, other kinds of contact lenses.
Mm-hmm. Okay, well, look, there are other options with lenses. It depends a little bit on what we find when we actually check your prescription and the cornea itself and the curve of the cornea and how much astigmatism's there. You've heard the word astigmatism?
I've heard it, but I actually don't understand.
Yeah. Often people with rigid lenses have astigmatism, and that's why they're fitted with hard contact lenses. To create astigmatism means that the cornea is a little bit flatter along one meridian and steeper along the other. That's the most common form of astigmatism.
Right.
And sometimes that can be difficult to correct with the soft contact lens because you need to have the lens to actually sit stably and sort of align with that astigmatism.
Now, take notes on the optometrist's explanation of one-wear lenses.
So the thing with you and full-time wear is probably, with soft contact lenses, were you to be suitable for them, most people these days go into disposable contact lenses, and there's a bigger range of contact lenses that are disposable and correct your astigmatism than there used to be in the past. One-wear contact lenses are also good. They're ones you just put in on the occasion and then you throw out, okay? So basically...
So how long do you wear them for?
Well, you can wear them all day,
right,
depending on how tolerant the eye is and whether you get ocular dryness. But I think you've been a fairly successful contact lens wearer.
Up until recently.
Yeah,
yes.
so I'd like to have a look at the physiology of the tear film and have a look at your cornea, make sure that there's no real dryness happening there.
Right, okay.
Sometimes people need to use lubricants with them.
Now look at question 7. You will hear a discussion about laser eye surgery. First, take notes on the reasons for Claire's interest.
I'd also like to know a little bit about laser eye surgery as an option, and I'd like to know your opinion on the procedure. Because, well, if I can do away with all of the problems, that would be ideal. I am a little bit apprehensive about it, but I don't know much about it. And one of the reasons that I am keen to find out more is that I've recently taken up a new sport and a high contact sport.
Right.
And so I would, glasses are really no good, but ideally I wouldn't have to wear any contact lenses either.
Now, take notes on the optometrist's opinion and explanation of the procedure.
So do you know very much about the laser procedures at all?
No, I don't.
Would you like me to chat a bit about that to you as well?
Please.
Look, I've got an open mind about laser refractive correction. I think for a lot of people it's a good option. I would say from your prescription that the most likely procedure that they would use if your cornea is thick enough is a procedure called LASIK, okay?
LASIK.
And yes, LASIK. And basically, I don't want to frighten you, and this is all done under anaesthesia, okay? But not a general anaesthetic, it's a topical anaesthetic. So what they do is they use either an intralase or a keratome, a microkeratome, to lift a flap off your cornea, okay? And all that laser surgery is about is really dealing with altering the structure of your eye, okay?
Now look at question 8. You will hear a further discussion about laser eye surgery. First, take notes on other considerations and the optometrist's advice.
There's, a few things about it that you should be thinking about, and one of them is laser surgery is elective. So basically, you would have to pay for that. And look, in Australia, the going rate for that surgery is about, anything from $4,000 to $5,000 for both eyes.
I was going to say, is that each eye or for both eyes?
For both eyes. So, and it really depends too on the physiology of the eye. And one of the things that you need to think about with what the ophthalmologist who does the surgery, and of course it wouldn't be me, I'm an optometrist, but I would perhaps give you a name of a few ophthalmologists, and you should perhaps at least check out your situation with perhaps two of them.
Yes.
And just so that you're comfortable with them, you have a look at their results, their success rates, and, get two opinions on the advice. But a bit depends on your corneal physiology. Now, basically, if your cornea is too thin and your prescription, being a fairly, high prescription here, you want to be sure that you've got enough corneal thickness to take the laser, okay?
Now, take notes on what the optometrist says about pain, recovery and medication.
Is it painful?
Look, there's some people experience a bit of discomfort, a bit of dryness dryness perhaps, but there's, you're given drops. I mean, you need some drops to make sure that there's no infection post-operatively and that there's no inflammation. Sometimes mostly people use lubricants as well. But actually, most people have a pretty good comfort response, within the first 24 hours and good vision.
That's impressive.
Okay? And even though you have that flap either lasered or cut off your cornea, there's no stitching or anything. The cornea is marvellous in terms of its healing, and it really heals pretty rapidly. Okay, and so that would be an option.
Now look at question 9. You will hear a discussion about a newer development. First, take notes on the optometrist's explanation.
I would say with your prescription that you might think about a few different options, perhaps not just laser. There's also a newer development now with implanted contact lenses, for example.
Oh, really?
Yes, so if your cornea is too thin, then that could be an option for you. Now, it's traditionally been used, more for extreme powers, and you're not quite there. But, if you were very keen and your cornea was too thin for this laser procedure, then that might be an option that you looked at as well.
Now, take notes on the procedure.
Now, it's a little bit sort of trickier in terms of the surgery because it's done in a day procedure centre. So, but, you don't go into hospital or anything like that. And I think generally they will do that on 2 separate occasions because there is a slightly higher risk of infection, which is something that any surgical procedure involves, with anything where you actually sort of open up an organ like the eye and insert a foreign body. So generally they'd wait and sort of make sure that the eye has responded properly, and you'd again have some drops like antibiotics and anti-inflammatories to help the eye recover more rapidly and more safely.
Now look at question 10. Take notes on Claire's next steps and options.
Well, what would you suggest, Jo, is the next step? I mean, you'll examine my eyes, but would you also perhaps give me the names or some recommendations, and I could perhaps make appointments to go and speak with some ophthalmologists and see what they think?
Yes. And I should have said, Claire, that it also depends on how stable your prescription is. So what we'd like to do is, basically have a look at your contact lenses, make sure that there isn't anything, health-wise that's affecting the comfort of those lenses.
Yes.
You would need to stop wearing the rigid lenses for probably a few weeks because they do alter the shape of your cornea.
Before surgery,
Before you had surgery, if you went ahead with that.
Yeah, that shouldn't be a problem.
If I was to refit you into soft contact lenses, if you decide, well, I'm sick of rigid lenses, and it seems to me that you are, and I want to consider my options, we could easily fit you with soft contact lenses today. Then if they need to be adjusted, we can do that in a week or so.
Oh, that's easy.
That would be perhaps a good thing to do, perhaps get you out of the rigid lenses.
And I can try the soft ones. And
if you love them,
then problem solved.
That's right. But if you feel that, well, this is good, but I want better, then we would have a more serious talk about the laser.
Excellent.
Okay, well, let's start with the test.
That is the end of part A.